One of the most effective ways that I have found for teaching patients and clients how to achieve intra-abdominal pressure is to utilize the very first position of functional progression part 1. So I'm going to have Jenna lie down on her back. As she gets into this position with her knees bent and her diaphragm on top of her pelvis, if I give her the cue of, Jenna, I want you to just pick up this leg without letting anything else in your body move, then what she'll find is that she actually has to create a little bit of tension in order to be able to do this. We're going to kick it up a notch because if I have Jenna come up into the starting point of functional progression 1, which is knee outside of the hip, foot higher than the knee, and a little bit more in than the knee so that the knee is actually pointing slightly outward. Now, Jenna, what I want you to do is not move anything else in your body, but bring this leg up to mirror what this leg is doing. Her only option is to create task-specific intra-abdominal pressure where she's expanding outward in order to allow her body to hold her legs up in this position. So give me a little bit more expansion here, Jenna. Very good. And she'll find that this is very, 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 very challenging, but this is one of the best ways to practice establishing intra-abdominal pressure. Go ahead and let your legs relax. So if we go through that again, we have diaphragm on top of pelvic floor. Jenna can practice breathing into her back while she's in this position, but that's different than establishing a pressurized core system. So practicing that, Jenna, go ahead and lift this leg up without letting anything else in your body move. She has to create tension here, and that's a pressurization of her core and a beautiful way to establish intra-abdominal pressure. Lifting one leg is not as intense as lifting both legs. So she has less intra-abdominal pressure right now compared to when she lifts her second leg. She needs to create more pressurized tension in order to be able to accomplish this task. So we want our intra-abdominal pressure to match the task at hand. Lifting one leg is less intra-abdominal pressure than lifting two legs. So task-specific intra-abdominal pressure, this is a great way to establish it.